Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institute. Our contact number is 76967 34256. For the best OET coaching, you can call us straight away. And please subscribe this YouTube channel for more than 1000 OET sample videos. And today we are going to discuss this part A, which is very important part when it comes to reading. So today we will discuss about how to manage your time in the reading part A, which is the one of the most important things, because if you consider reading part A has got 20 question, reading part B and C together have got 22 questions. So reading part A is equal to reading part B and C. So if you are good at reading part A, there are high chances you if you correct 20 questions or 18 questions in the reading part A, that means you will surely pass reading. So today I am going to tell you the method. I don't know what kind of reading it is. Is it easy or difficult? I don't have any idea, but I will try and execute it. Now my clock says my clock is at 9 minutes and 20 seconds. So I'm going to start from here, and I hope I would be able to finish it by 25 minutes after telling you each and everything. So I will start it now. So I'm just going to start the reading. So suppose in the reading part A, look at the four text A, B, C, and D in the separate text booklet. For each question 1 to 20, look through the text A to D to find the relevant information. Write your answers on the spaces provided. These are the spaces. Answer all the questions within 15-minute time. So you will get only 15 minutes to answer 20 questions. So what I will do, the topic is of deep vein thrombosis. I will read the 7 questions. Warning signs of deep vein thrombosis. So suppose I have exam. So I will underline this word. Sorry, I will take the underline thing. Yeah. So warning signs. Hormone that increases the risk of DVT. Hormone. Definition for clotting cascade. Clotting cascade. What does it feel like when there is a blood clot? Blood clot and feeling. Blood clot and feeling. Care for DVT patients means care means it should come in the management part or the treatment part, care, or in the precaution part. So care word is very important. So that is how you do. You keep on doing various things. You keep on doing various things to understand what questions. So care means treatment or management. Common drug regimen, again, treatment or drugs, medications, factors that increase the danger of DVT. Now I have read 7 questions. I will try to remember these main words. Feeling of when clot, warning signs, hormone, clotting cascade, care, drug regimen, and factors that increase the danger of DVT. So factors. So what I will do, I will go to my paper and I will try to see. D statement says these medications, and it talks about blood clot. DVT medications are anticoagulants, talking about the way how to do that. 2 older anticoagulants. So this is all about medication. So management part can be from this. Then this is about nursing intervention for deep vein thrombosis. So I will read couple of points to understand what are the interventions. So it says assess for the report, sign and symptoms, keep elevated. So this looks like those precautions for the deep vein thrombosis. Carefully heparin dose, this and this, provide elastic compression, oxygen. So all these points are given in this. So this is talking about the various management, and the last one is talking about the medication. Then I go to part B. Part B is talking about causes of deep vein thrombosis. And if I can see blood clots, including chemotherapy, blood clots. So these all words are given over here. What are the factors leading to deep vein thrombosis? And then I go to first page, then first A part, then it talks about thrombus, can cause the symptoms but may vary without. It can cause leg pain or swelling, means effects of this, deep vein thrombosis. It usually affects legs, veins. So it is talking about the effects of deep. Common symptoms, feeling this, headache. I was trying to find that word clotting cascade. Somehow it should have been over here only, but I have not been able to talk about that clotting cascade somehow. I was thinking at least that question I would find. I'm telling you just the kind of a question I was thinking that I would be able to find easily. And over here, I could not find clotting cascade, which I was thinking that it should be very easy question to find clotting cascade. Oh, here is the word clotting cascade. So I was thinking that this should be an easy question. So you must know out of the 7 question, which is easy to be found. So at least clotting cascade answer is 100% correct. So this gives me confidence. So I do not miss out on the first 7 questions. Warning signs of deep vein thrombosis. I think warning signs should be in the first because they were talking about various things, or maximum in the second. Warning signs should be in the first or second. But warning sign word, if I can find sign word, so I think it should be one only because they were talking there would be blood may occur without any symptoms. But then they were talking about symptoms as well, like warning signs means pain, feeling, swelling, tenderness. So I think I should do A, but this question I am not sure. But again, I would not waste my time. Means first A or B, but I will not waste my time. Hormone that increases. Hormone means causes. Hormone that increases. So that means that must be in the 100% causes, should be in the causes part. But anyhow, hormone replacement therapy. So hormone word is anyhow given. So I would do this B. Okay. It might be wrong, but I'm telling you how to do it in the exam quickly. So A and B, I have not found the exact places. So that is what you need to do. I have not found the exact places, but hormone that increases the risk of DVT means it is talking about the causes of DVT. So that is how you need to guess. If by chance you do not find the word hormone, then do it B because it is they are asking about the cause. So that is how you should do. Only by reading the headings of the text A, B, C, D, then definition of clotting cascade we have found in D. At least one question is 100% safe. How does it feel when there is a blood clot? After blood clot, what is the feeling? Pain, that feeling word. So 100% should be A. Care for DVT patients, 100% should be C. Care means the kind of therapies, other therapies. Common drug, 100% should be D. Factors that increase the danger. Again, talking about the factors means causes that increase the risk of DVT. Danger means risk. So it should be B. Now I have done 7 questions. I feel maybe 7 will be all right. Maybe 6 would be right, but at least 5 would be surely right. So I have not wasted any time. I'm just teaching you. That is why it is taking time. But even after teaching you, it has taken me total 5 minutes to solve these questions. But in final exam, it should take around 2.5 to 3 minutes only. That's it. Then you go into this page. What is the drug used for the pain management? Now, this strategy, what you have followed in the first 7 questions should be followed here. What is the drug used for pain management? So now I know it should be in the D. So in the D, I just have to find the word pain management. If I can find the word pain management, or maximum can be in the C. It can be either of these D and C. So I would try to find the word pain management. Pain management, morphine. So name of the drug, morphine. That is how you do it. It's either in C or in D. So I did the D. Oh, sorry, morphine. That is the strategy. That is how you say what is the combination of complication of warfarin therapy. So warfarin therapy, it should be either here, a coagulance complication. Note does not talk about complication. It should be warfarin word. Yeah, excessive bleeding. Answer C. That is how excessive bleeding can be the complication of this, as per me. Or be aware of excessive bleeding such as this, but I would say excessive bleeding is one of the main things. Then it can lead to epistasis. Be aware of the signs of excessive such as this and this, but I cannot fit all the, I want to fit this and this word because these are the complications. Purpura, hematuria, and this frequent bilateral epistasis. But according to the final exam, I cannot fill in these 3 words. So I will say excessive bleeding. Any sign of excessive bleeding, complication of warfarin. So I will go with excessive bleeding. I want to fit these words, but if it would have been given one, only purpura, then I would have fit it. But there are 3 words. I can't use all that words. So again, want to save my time, excessive bleeding. So that is which age group is at the risk of developing DVT more? Either A or should be B, because A and B were there. A and B were talking about this. So I would like to above 40. So that is how fast it is going, above 40. Okay, then I will go to 13th. What does DVT pain feel like? Again, it should be in the A. That is how I am saving time. I'm telling you again and again. So I forgot the question, sorry, in telling you, in the quest of telling you. And also in the exam, it would be easy to shuffle the pages. That is why I encourage not to take computer test. Always take pen and paper pencil test. It's comparatively easy. But yeah, computer, because you have to scroll it down and up, which is very hard. But anyhow, what does DVT pain feel like? It should be 100% in the A, as well as as far as I think. Uh, Symptoms include pain, throbbing, cramp, like feeling and swelling, throbbing, cramp like feeling. So this is the feeling of the pain, throbbing, cramp. Simple. You don't have to, reading part A is very easy. You just have to save time. The problem is management of time, and you can manage the time by following this strategy, that at least you should know in which paragraph. Even if you save 5 seconds, if you already know this is the paragraph, if you save 5 seconds, then 20 into 5 makes 100 seconds. 100 seconds means more than 1.5 minutes. So if you are able to complete 17 questions in the reading part A, with this strategy, you can definitely complete 20 questions, because you will have more than 1.5 minutes extra. And if you save 10 seconds, then it means you are saving 300 seconds. 200. If you save 10 seconds in each question, then it is like 200 seconds. 200 seconds means 3.5 minutes. So you have lot of margin if you follow this strategy. This is the best strategy of reading part A. Just focus where it should be. Where does the thrombus most commonly form? Thrombus again is a complication, so it should be in the part B. Thrombus or in the A. Maximum in thrombus in the part B or A. Thrombus word, thrombus, it's not given over here. Thrombus word I did read, yeah, thrombus. Forms in one or more of the deep veins in the body. So deep veins usually in the legs, but I cannot fit in the legs. So deep veins. If it has asked me about the part, part means legs can also be the answer. So now I'm confused. So I would like to save this time. Where does thrombus, where means where? So it can be deep vein in the legs. So legs can also be the answer. So I'm changing my answers from deep veins to leg, because where? In hands, where? In legs. So I think it should be legs only. Okay, which it can be wrong. Now this is the first question I think can be wrong. Out of 7, I think 1 or 2 can be wrong. But this is the first question I'm confused about, deep vein or legs. I don't know. Which category does heparin and warfarin belong to? Now I know heparin and warfarin either D or either C, because they are the treatment. Heparin and warfarin. So anticoagulants, anticoagulants. Again, older anticoagulants or anticoagulants. Either, even if you by chance write older anticoagulants, even then it's fine. Then you go to which type of drugs are used to treat deep vein thrombosis. Which type of drugs are used to use? So these are anticoagulants only. Which type of drugs? So these are the type of drugs, and these are new anticoagulants. Again, the answer is same. Anticoagulant drugs. So both the answers are coming out to be anticoagulants. So I would like to fit older anticoagulants in the last question. Now older word becomes more important because 2 questions are same. Okay. Interfere with the bodies, the process. Okay. So this is a very good question created by this IRS group. Highly thankful to this group. Again, Dr. BKM is all about telling you how to do it. So my job is that. So see, we have completed 14 questions overall minute by talking to you. Even after telling you everything, we have reached to 22. So it's almost 12 to 13 minutes. I have done almost every question. Improve the flow of blood and decreasing swelling and pain is the advantage of flow of blood. It should be in the part C, flow of blood, improvement. And the other word I forgot, improvement in the flow of the blood. Improvement in the flow of the blood, blood flow. Discourage positions that compromise blood flow. So if that is the other word is also uh, improving the blood, decreasing swelling, and is the advantage of posture, advantage of, sorry, blood flow, and what is the other word? And swelling and pain. Swelling. Somebody is coming, so I have to admit them. Sorry. I'm taking 2 more people in. Okay, improving the flow of blood and decreasing swelling and pain. I have not seen the word swelling and pain. Blood flow I have found. Do not mix swelling and pain. Blood flow, but also reduce swelling. Yes. Elastic compression stocking. So I have to find both the words. So blood flow, swelling and pain, elastic compression stocking. So that is how you go about it. See, it's not taking time. 16. The complication of DVT is, complication means either A or B. So complication is the contraceptive pill. It either of these, the risk of DVT is slightly increased, but it does not talk about complication. Estrogen causes the blood clot, but complication of DVT is, no, it is the cause. It cannot be in the cause. Sorry, it cannot be in the cause. It should be in this. So blood clots, thrombus, it can cause leg pain and deep into serious condition, can break loose, travel through the bloodstream, blocking the blood flow. Although it can, this DVT in upper extremities can cause sinuses, hepatic, and so this is tough again. I cannot find the complication because this is also complication, and blocking the blood flow is also the complication. Obstructing the lung is also a complication. So blood clot is the only word that I can find a common word, because ultimately it is the blood clot that is leading to all complications. So I think blood clot or thrombus should be the answer, blood clot. But again, I will not waste time. I can afford two questions to be wrong, but I cannot waste time in the start. But I will put a mark over here like this in the final exam. I will put a mark over here like this. I want to do this question again like this. I will put a mark that I will do it again later. So this was the thing. So this, which was the question number? So this was question number 16, which I think I could have done right. So I just put a dot over here, small dot over here, to make sure this is not a good dot. I will use the proper dot. Yeah. So I will put a very small dot in the exam like this, just a small dot, to make sure, just a small dot, that I have to do this question again, because I'm not sure, but this is in my reach. Blood clot obstructs the lungs and thereby block the, we have just read that word. So lungs, after lungs there was a word. So that means now you know where it is. So that is what is saving time. Block the lungs. So I just read the word, that lungs blocking the blood flow, obstruct the lungs, blocking the blood flow. So blood flow should be the answer if it is the block word. So yeah, and thereby block the blood flow. The female hormone estrogen, I read it somewhere. So I would save time. Injectable solution of Dapletin is available by the name. So I just have to tell the brand name. It should be in the D. Deltapin, and this is the injectable from Fragmin. So this is my answer. See, easy questions are always in the end. That is where we lose time. And now in the last minute, last question, deep tissue bruising is termed as, it should be in the complications again. Deep tissue bruising is, it should be in the complication. Deep tissue bruising is known as complication. Not this one. Deep tissue word. Deep tissue word. Deep tissue word should be over here only. It should not be here and there. Okay. Deep tissue word. If it is given here, over here somewhere. Deep tissue bruising. Purpura. So now my reading is done. I would like to take your feedback, what you have understood from this class. Again, I'm telling you, there will be many things that will bother you. But again, it's just about focusing how to do it. So within like 15 minutes, I have done it all. I have not spared any question. I have done 3 or 4 guessworks are there, which if I would have been doing alone, I could have done this thing in 12 minutes or 13 minutes, saving my time. Okay. So please let me know. I'm just going to unmute you to ask about your doubts. Please let me know if you have all understood this method and how many questions are correct and how many are wrong. How many are wrong? How many are wrong, guys? Many?
No, sir.
Almost all good? 1 or 2?
Yes, sir.
1 or 2 hours, obviously. I have to save time. So A was correct, B was correct, D I did correct. D, A, C, D, B, all these were correct?
Yes, sir.
Great. Morphine,
Yes, sir.
bleeding, I am not quite sure whether I did or not. Morphine I did, I remember. Above 40 I did. Thrombic cramp I did. Leg, got it correct. Where means in the legs. So that I got correct. These two questions I am proud of myself. These were the hard questions. Leg and older word. Because the next question was also anticoagulant, so I got it that he wanted to ask which category. If you write only anticoagulants, it can be right, but they ask which category, older or newer. So that is where I use the word older. And then stockings, yes, I did. Or even if I have written, that is better to write deep compression stockings, means complete word. Elastic compression stockings should have been the right answer. So pulmonary embolism I did wrong. Blood flow is right. Estrogen I know is right. Levonox, how could it be wrong? Because they asked me about the injectable form, right?
No, sir, this answer is wrong in the answer sheet.
Yes, sir.
It cannot be Levonox.
So only one question I have done wrong. Only one question with all this. So that is how you need to do all these questions. This is Dr. Bhupesh from Dr. BKM Institutes talking about the easiest of the methods to do your reading part. Thank you very much. And please listen to this recording again, because one time does not go into your subconscious mind. We have to take these methods and we should be sure about these methods. Then we would be able to implement it. Please listen to this recording right now. Subscribe our channel and call us on 76967 34256 for the best OET coaching. Thank you.